Hi everyone, it's Lisa with livingwithasthma.net, here with another Asthma House Call where we get to sit down and talk to some of the very best doctors who treat children with asthma. Today we're here with Dr. Gital Patel of Premier Allergy of Ohio. Dr. Patel is board certified in pediatrics and pediatric and adult allergy and immunology. She has been involved in the latest research and was recently published in the Annals of Allergy, Asthma, and Immunology. Thanks, Dr. Patel. We're so glad you could be with us.
Thanks for having me.
Now, just to start, for those parents who may be at the beginning of their asthma journey, what is asthma and why does it seem like so many children have it?
Well, to start with, asthma is basically our lungs are made of small airways, which are just small tubes that carry air in and out of our lungs. And people that have asthma tend to have inflamed airways, which makes them swollen and very sensitive. And so when they are in contact with an inhaled substance, they do tend to react pretty strongly. And when that happens, the muscles tighten around them, which narrows the airways, and that inhibits some of that air flowing into the lungs. And so, those cells in the airway can also make mucus, and that can be a sticky, thick liquid, and that can also make the airways pretty narrow. We are seeing a lot more children in general being diagnosed with asthma. The CDC says that the prevalence has increased just from 1980 to 1996 to greater than 50%, and that largest increase was in children younger than 18 years of age. Why is that happening? There's a lot of different theories. I don't think anyone really knows for sure what exactly is causing it. One thing is called the hygiene hypothesis, which has to do with, we're just a cleaner society in general these days. So our bodies are not exposed to as many bacteria and other infectious pathogens. So that kind of puts an imbalance in our immune system, and so then the allergies tend to overreact a little bit. There's also more indoor air pollution. We're seeing more early onset viral infections in the lungs, things like that may explain why we're seeing it more now. And also just increased awareness and more recognition of asthma by patients and by clinicians.